Good morning.
Mm.
Yay. Oh, so many beautiful familiar faces.
Good morning, Pilates World Book Club. Yay!
Woohoo. Thank you so much for joining us. I am Sarah Arthanagara, one of the founders of our Pilates World Book Club. And today I'll be going through just some housekeeping to top things off, um, giving you the lay of the land of the structure. And also, I just want to say thank you so much for joining us on a Sunday morning. It really, those of you who are here, um, I think that I know most of you, and you're here in California, so you're not logging in at some crazy odd hour, but 10 a.m. is a little crazy odd hour for me on a Sunday morning. Anybody else? Right? So yeah, so it shows your commitment to the subject of looking at safe movement for all spines, the title of the book that Gwen has written for all of us. So I'll be going again over some details and housekeeping, our reminders, and then going through some introductions of myself and Gwen. And then Gwen will be sharing, excuse me, brought my water. Gwen will be sharing an excerpt from her text, her book with us. And I don't know what she's chosen, so I'm excited to find out. And then I have a number of curated questions I'll be popping out at Gwen. And those can really be fluid. If we want to dive in and get a little deeper into any one subject question area, we can go down the rabbit hole. And then if my questions don't necessarily take us farther, then you are also welcome to pop your own questions in the chat and or raise your hand. There will definitely at the end be more of an open Q&A. All right. So it's time to make sure that our sound is off right now, except for Gwen and I, and that you try to free your whole space of distraction. So as best as possible. But we do love to see your kids, animals, or whatnot pop on through, and would be really great for anyone in the family to listen in on this. So I wouldn't say, shut everybody out of the room. You want people to be eavesdropping. All right. And we would love to see your beautiful faces if you are so inclined to pop on your video. And I will be recording this meeting. And so I will be recording just those that are unmuted and speaking. So Gwen and I will be recorded. And then should you choose to pop on your video and mic, then you will also be in our recording that will go out to all of our members and be posted on our YouTube channel. So just if you do that, right, that's like a consent that you're saying, yes, it's fine for you to put this out into the world. All right. Yeah, we can see some head nods. Thank you. All right. So again, my name is Sarah Arthanagara. I founded this book club with Claire Sparrow, and we had this wonderful moment when we were together going through the Pilates Master Mentor program with Lolita San Miguel, where we were nerding out on all the books that we love that are not necessarily just Pilates, but also fascia, anatomy, and whatnot. And so we decided that it would be so wonderful to create this Pilates book club and connect with all of the other Pilates nerds out in the world. And she is from Scotland and lives in England right now. And we have many other international friends between us. So trying to just bring everyone together and connect in this subject, I think is a really beautiful thing because we're all so passionate about it. So I know I am passionate about my own spinal health as well as my clients. And I'm going to take a moment to drink some water as I pass it along to Gwen to introduce herself.
Okay, I was just gonna take a drink of water too
Yeah,
on your
cheers.
cue. Yeah, yeah. Well, hi everybody. Gwen Miller, and author of Safe Movement for All Spines, as you know, and thanks for being here. And I'm of course, author and an educator like Sarah for Balanced Body Pilates, Balanced Body Education. I'm also a Hendrickson method manual therapist and yoga therapist, yoga teacher, Pilates teacher, personal trainer, group exercise instructor, and a Czech practitioner from way back. That was actually my first certification. You know, it's interesting to me in the world of fitness. I feel like that we as Pilates instructors are some of the most highly educated, possibly overqualified people in the fitness industry. It amazes me the passion, dedication, and amount of study that Pilates instructors embark on. So I'm happy to be here, and I live up in northern North Bay, California, with I've got a family of six, and 7 cats and a giant tortoise, and that's me. So I'm glad you're all here. Thanks for being here.
Unmute. Thank you,
Right.
Gwen, for introducing yourself, and thank you all who are present with us today for dropping in your locations in the chat. It's really fun to see where you are. So Hayward and San Francisco, a lot of San Francisco and Redwood City, San Mateo, Sunnyvale, Burlingame, San Jose, Santa Cruz. Yeah, it's a little chilly here this morning, which I'm kind of loving. Outside my studio window, there's all of these maple trees and all the colors are changing. So gorgeous. So I have a poll for you all. I was going to drop it at the very beginning of this meeting, but Gwen, just because I had spoken with you earlier, I'm going to go ahead and hold off and let you read an excerpt of your book. I'll drop the questionnaire in there after the reading, and so we'll have a moment to digest as you yeah, you can digest and you can take the poll. We'll take a moment and then we'll dive into the questions. So we'll just shift things around a little bit.
Okay. Well, I was trying to figure out like which reading should I start with, and since we all have probably different focuses and different clientele that we're working with right now, you know, through the years, I've had a client come in to my practice that I've considered my muse, kind of like a muse in art. And that client has inspired me to do study and to research and really like go down the rabbit hole in program design. And so I thought, you know, we all have different muses, but the most important piece when you do have a muse walk in your door is, I think, is listening. So I chose from chapter 11, The Language of Healing. If you have a copy of Safe Movement for All Spines, it's on page 303, the section on listening. A therapist or practitioner helping a client or patient in pain creates a safe place for healing to occur by treating that person with respect, consideration, kindness, and meeting them where they are. We invite communication by asking questions. We listen to them without judgment as they share their experiences. Every person has their own experiences, and though there may be threads of similarity from one case to the next, each person experiences their journey in their own way. Many people whom I have listened to while taking their history prior to treatment have recounted weeks, months, even years of trying one thing or another, moving from medical to alternative care and back again. Some of the stories are long, some even longer. Sadly, some of the worst cases have told me that I was the first person they felt had really listened to them. What a gift we can give by simply listening to someone. My mother was an ordained interfaith minister who found her calling in animal communication and grief counseling. Her memorial service was attended by over 300 members of her community, friends, and family. When the time came for the attendees to speak, One after another, they spoke of her service, the wonderful things she had done for her community and for them personally. One thing was repeated more than any other. Time after time, the people who honored her spoke of how she listened to them. They spoke about the way she held the space for them to talk and share their feelings, and that they had felt acknowledged and heard. Of all the wonderful and compassionate actions in her life, the one thing people valued most about her was that she listened well. Listening is important because it helps validate a person's experience, and in the clinical sense, there are many clues to be gleaned from listening to the details of the stories. I've had clients whose technical and medical knowledge about their bodies and their diagnoses surpassed my own. They became experts on their own behalf in their quest for healing. If I do not know something, it's an opportunity to learn. Looking at a problem from the outside with eyes and mind that are not clouded by preformed ideas often leads to questions that create clarity of direction towards solutions. I've had clients who did not understand what their diagnosis meant and were afraid to do anything for fear that it might cause pain or worsen their situation. I've had clients bring me hand-drawn picture maps of their pain and how it manifests day to day after certain activities, and how the methods described in this book have helped improve their condition and resolve their pain. Simply being heard relieves stress and allows the body to better access a healing state. Feeling unheard drives a wedge between the person who needs to heal and the person from whom they seek healing guidance. The wedge then interferes with something called co-regulation, which is a state of perceived safety in which the nervous system is open to responding positively to information and treatment. Co-regulation is needed to guide someone towards self-regulation, which is the ability to manage our thoughts, feelings, actions, and responses to stress. Information can be in the form of conversation, instructions, receptivity to touch, as in manual therapy, receptivity to exploring non-painful movement, and many other examples. If someone feels unheard, they close up instead of open up, and no matter how good the practitioner or healthcare provider is, the treatment may not be as effective. I've heard stories that seemed almost unbelievable and have worked with people whose pain seemed disproportionately severe, random, and unexplainable. Gently, consistently listening, accepting what I hear, and taking appropriate action with loving kindness helps most of the people I've had the privilege to work with. Listening and not prejudging takes practice. It takes keeping your mouth shut and not jumping to conclusions or thinking that you know what someone's going to say next, and especially not planning what you're going to say next. Do not ever assume that you know what someone's experience is because it seems similar to yours or someone's you've heard about. This is discounting the person's experience, and it is not listening. Thinking of your response while someone is still speaking is called already listening, which means you've stopped listening to them and are now listening to yourself instead. If you find that you're formulating a response in your mind while someone is still speaking, try jotting down a quick note to let the thought leave your mind so that you can focus on what the person is sharing with you. A purpose of taking notes is to keep one's mind clear for listening as much as it is to record information. I love that chapter. That chapter is really personal to me. It's my experience. And, people, all you that read the book or that listened to this piece of it, you have different experiences, and your experiences are going to be different from mine. So we're all working with people from our own lens. And that's really what this is about. So, it's the thing about already listening. I learned that from someone who was doing neurolinguistic programming back in the 80s. Yeah, I'm pretty old. And so but that person who did neurolinguistic programming taught me that, and taught me also that just because somebody is in a helping field doesn't mean that they're the right person to guide you, right? So, so that's where that piece comes from. And I've found this idea of already listening to be extremely powerful and really being able to utilize my note taking as I am listening to be able to get those thoughts out of my mind so that I can just be open to receiving whatever that person needs to share. So I'm sure you all are doing the same. Anybody who works with people who are in pain or who have things going on with their spine or their joints is going to be in a position where people are coming to us and sharing because of their fear and their experience and the possible medical gaslighting they've been through and those types of situations. Anyway,
Yeah, I think
thoughts?
that is
Yeah.
so powerful. The art of listening, and it's a challenging one sometimes for some of us. I know my brain works a million miles an hour sometimes, and I get so excited, right, to jump in and join the conversation. So I love that reminder of biting my tongue a little more, sit back, and really allow um, the person in front of me to have that space and time, right, to also digest their own thoughts before they're delivered to you. Because we all process at different speeds, and that's something that I'm really passionate about. Is especially lately is neurodiversity, and that we all communicate a little bit differently too. And so that deep listening skill is something that um, is really powerful to help us help others almost more expeditedly, if that's a word. And I know Gwen and I, we both also have this balanced body family background, I'll say, to describe it, that we're from an ilk of people that really believe in, um, we've learned that there are certain conditions that can happen in our body that are very common, as I'm sure we'll get into, like disc issues and generalized low back pain that may not have a diagnosis and things like that. And we have certain protocols that we take for those. I mean, we have a certain set of protocols, but we also are taught by one of our mentors, and I'm sure others, but our mentor, Nora St. John, who started the Balanced Body Education Program, that uh, these are guidelines, and someone who comes in having a disc injury per se, we have our set of protocols to try, but it's always an experiment. And it really takes listening to that person too, and researching and digesting the information that they're sharing with us to see, are those protocols really the best way to approach this particular person. All right. So I know what some of the statistics are around back pain, and I'm curious to see within this group um, what we've experienced in our own lives, and what we know about those that have come into our lives with regard to back pain. So I've created a little back pain and conditions poll for us to take, which may help to further our conversation now or later on. So I'm going to go ahead and launch this. Let us digest what Gwen just shared with us, and then we'll come into more question and answer conversation. So the questions are, if you're watching this recording later, have you ever experienced back pain? Yes or no? Do you have a diagnosed spinal condition, like a bone, joint, muscle, tendon, or ligament condition? And do you know someone with a spinal condition? And then Gwen, I know most of the members here that I see online today are Pilates instructors. However,
Mhm.
there are some Pilates students as well.
Oh, great.
Mhm.
It's awesome. Dive right in. Love it.
Yeah, I love having the conversation, but bringing the whole community together. That's something that I'm doing also in a monthly class that I'm calling Sarah's Magic Circle. Um, I'm trying to get more clients and teachers connecting with one another and understanding each other's experience to really empower people on both sides. There's so much that we can learn when you understand what the teacher is going through as well on the client's side, and they don't always know that.
Well, we were talking about that, when you and I had our short meeting that ran for like an hour and a half that night a few weeks ago, that we're really kind of on the same path. We're sort of on these sort of parallel paths, we're both working with junior college Pilates teacher training programs. We're both balanced body educators. We both see that there's no conflict there between those two, passions, and that we are very much interested in building community. And so building this community of experienced teachers, teacher trainees, newer teachers and clients and lay people, it's a beautiful thing, because I think we've got a lot to learn from each other.
Indeed. So looking at this poll, it's always fascinating to see. So the question again, the first question was, have you ever experienced back pain? Oh, I'm going to go ahead and end the poll so all of you can see these numbers too. All right. So it's 100%. And I believe the statistic that I have read most recently was something like 89% of people at some point in their lives have back pain. And maybe it's higher. Maybe it's just that it's not all reported. Then the next question we have, do you have a diagnosed spinal condition? And 42% said yes. Let's see, this is a little, okay, well, there's 42% said yes and 58% said no. And then, do you know someone with a spinal condition? 92%.
Yep, that's about right. At least in our country. I don't know what the stats are for other countries, but last I looked, I think it was somewhere in the high 80 percentile of people who'd experienced back pain. Yeah, not everybody has a diagnosis. And that's called non-specific back pain or non-specific low back pain. And so pretty common causes of that can be muscle strains or ligament strains. And those can clear up on their own. I mean, most of it can clear up on its own over time, given the right, I hesitate to say right, the appropriate treatment or course of action. So, yeah.
I think that segues right into this question that I had for you, which is, what was the most challenging aspect of creating a comprehensive guide that covers such a wide range of spinal conditions?
The most challenging aspect of creating a comprehensive guide that covers all of these spinal conditions, and we remember we're also talking about hip variance conditions and SI joint dysfunction and sciatica and hypermobility and scoliosis, right? So we've got 9 different chapters. I think the first most challenging aspect was how to organize the material. I, being a Czech practitioner for over 2 decades now, we were taught to do an assessment of the entire body, bony structure, muscle length tension, all of that. And We also do assessment, muscle testing, etc., and as Henderson method therapists. And I think it was just that it was almost overwhelming to me to be able to figure out, like, how do I curate this and collate all this? And I had a couple of false starts while I was writing the book, actually. My first attempt at writing the book, I wrote an entire chapter on assessment. And I put all the assessments down and I was like, okay, so we'll do these assessments. And then if you do this, it was almost like this flow chart, right? If you have like a positive, which means usually people are it's painful if it's positive, which isn't really positive, but anyway, that's just what they say. And so if you have these things, then look here, kind of. And I got done writing that chapter, and it took quite a bit of time. And I looked at it and I went, I'm boring myself. Nobody's going to read this. This is not accessible. And so what do I do? And I actually got my inspiration for how I organize the material from a book called Mutants. And this is a book actually on embryology that I read. And the person who wrote the book, I don't recall the name of the author right now, unfortunately. But this person had taken a look at all of the old like sideshow or carnival people who were literally exhibited as carnival sideshow freaks back in the 1800s, maybe early 1900s, the merman, the bearded woman, these conjoined twins, things like that. And the way that he wrote this book, he told a story about the person and then went into the embryology and exactly where in the cell division process that difference occurred in that human. And so it was a fascinating for me because I find things fascinating and fun that other people don't, which I'm sure maybe some of you have that in common. But it was a fascinating dive into the embryology where if it had been just a dry, this is what happens when the cell divides kind of thing, I probably wouldn't have been able to have the staying power with it. And so from that, I went, what I really want to do is make this information accessible. I mean, I've had teachers, other colleagues, students, clients telling me I should write a book for years. And so what we all have in common is that we're human. And I thought I would just start with a human story. And then I thought, well, what's happened when someone has come into my life and become my muse, they've had a thing or a few things that are issues for them. And so why not organize the material so that anybody could pick up the book and not have to read the whole thing, not have to go through some boring chapter on assessment. I mean, assessment's important, don't get me wrong, but be able to pick up the book and go, okay, this person's walking in with, a disc derangement or with ankylosing spondylitis, and be able to open the book up to that chapter and just use it as a resource. And, for experienced instructors, it's kind of like, it's an affirmation. You don't have to like re-look up something. It's right in there. And then you've got new ideas maybe, or an affirmation that what your thoughts were is in alignment with somebody else's thoughts who's, put together the research in the book. And for a newer instructor, it's a foundation. And I mean, I'm sure we've all done this too. I don't know how many times, how many hours that we've spent of literally unpaid time doing research on someone who walks in with a condition that was new to us. So I just really wanted to make life easier for
Yeah.
everybody. But
So
that was
Gwen,
the most challenging aspect.
yeah.
So there was
So
another
I,
challenging aspect too, but you have another question.
I
Go
do,
ahead.
and it's in the same line of thought. So I know also that also reminds me about how both Gwen and I, we both are now starting to deliver balanced bodies, advanced movement principles for the lower back training. And what that's really about is exactly what she was talking about, diving into looking at these different spinal conditions and or undiagnosed low back pain, and then brainstorming together like the in-person piece of it, which you have to do in person, not online. It's really taking a look at all of the different bodies that are in the room, so it's like practical application, and starting to think about that case study idea, and how can we help this specific person. So my next question for you, Gwen, is uh, can you share a specific case study slash, it doesn't have to be like a formal case study, right? But um, a client where you applied the principles from the book to help them with a challenging spinal condition?
Sure, yeah. And as far as advanced movement principles, Nora wrote an endorsement in my book. It was really just so kind of her to take the time to do that. And my book is actually a really great companion for that low back course. It has in there, it's just a little bit more specificity and a little bit more information on some of the low back. And of course, there's more than low back in there, but um, and the idea of a case study is I've been teaching the curriculum based on my book for 3 years now. Um, I've got a final case study requirement for teachers to become Safe Movement for All Spines authorized teachers, and credentialed teachers. And the case study has to do with, show like how do you apply it to a real life person. So it's a really great idea, no matter what type of study that you're pursuing or where your passion is, that you start documenting your client files, like your client records, kind of like a case study, like what worked and what didn't work, and have a plan. The case study that I'll tell you about is, well, there's Susan's story, which is in chapter 10. You can read that, but the one that I really want to key on right now is about Karen. And this was the other challenge in writing the book for me. So basically, when I sat down to write the book, I just did a brain dump. And then I had to go back and do the research to prove how I knew what I knew was correct. And there were a couple of things that had been disproven by more current research. Okay, so I went through and did all of the research, and we did the source citations and et cetera, et cetera. And then I sent all the chapters out to people who actually had the conditions, and to Pilates and yoga and personal trainers, and to exercise physiologists, physical therapists, medical doctors, chiropractors, so you name it. So the book was read by, gosh, so many people before it even went through its final editing. And what happened is that chapter 8 on hypermobility, I was getting, a lot of like, oh, good, that's great, atta girl kind of stuff. And this one person who chose to remain anonymous, so didn't even want me to do an acknowledgement in the book, said, you know, current pain research is really kind of questioning some of these ideas. And, you know, part of the old physical therapy protocols, such as keep them in their mid-range and stay out of the end range, and don't let people that are hypermobile completely extend their joints because they'll cause damage. We were all taught this, especially those of us that are like, more experienced and longer term teachers. We were all taught this. And I think it was really fear-based because, you see someone extend their knee and they go beyond a range of motion that is your own lived experience. I mean, I'm like the opposite of a hypermobile person. I often tell people, if you ever see me do the splits, just call 911. Don't even hesitate because something is wrong. Okay. But so I got this feedback and I was like, okay, this is ringing true. And this is from the lived experience of someone who is well educated and is a hypermobile human. So I went and dove deep into the research for that. And so as I was doing the research, redoing, I actually almost threw the chapter out. I was like, we were at the end of the editing process. She was one of the last people who sent the chapter back. And I was like, oh my God. And at the time, I was like also helping Dr. Hendrickson edit his third edition. I mean, and working. I mean, it was crazy, I don't even know to this day how I did it, you guys. But I almost threw the chapter out and I went, okay, wait a minute, because if there's a lot of old information out there right now about this category of humans, then if I'm in service, then I need to like button down and really make this right. And so I started doing the research, like more and more and more research, because the older stuff was like basically, saying, oh yeah, you're on the right track. Well, I looked into pain science and all that. As I was doing this research, I started to realize that one of my clients most certainly, assuredly had Ehlers-Danlos syndrome, didn't know it, wasn't diagnosed. And so when I started talking to her about that, she was like, I don't need one more diagnosis. And she was really like not open to even asking her doctor about going in for genetic testing. But she is now, because over the years, we've had conversations around, well, it may not just, she said, it's not going to change anything. I'm like, yeah. What about your daughters though? What about them? And what about, just like knowing where to look? Because we know that there's 28 different kinds of collagens. And if there's a difference in the genetic makeup of one of these types of collagens, then, what if that collagen exists somewhere in your body and now they know where to specifically look, like the heart, the eyes, okay, anywhere. So as I was doing this research and realizing this about this person, I started developing a protocol, which I've expanded on since the book was published. And the protocol basically is like this. Lots of people who have hypermobility have a dysregulated nervous system, because it's like, if you consider, how would you feel if you couldn't really count on your body and where you know where you are in space? I think it's going to make anybody just feel kind of like a little, have some anxiety. So when I see her, I just let her talk. So I practice the listening skills that we were just talking about. And then I check in. What would you like to do today? Okay, so immediately I partner with her in constructing the program that we're going to do. And we start with, let's do some isometrics. So some of them are in the book, and I've developed others over, the last couple of years since the book was published. And so we do isometrics to downregulate the anxiety in her nervous system, to let her feel where she is in space, to reduce tension in the outer unit muscles, and to bring her stabilizers more online. Okay. And this is how every session starts, is with some isometrics. And these are very low intensity. And it's basically, figure out where we are in space, figure out what our tolerance for activity is going to be for today. And then as soon as possible, get her upright, either seated or standing. And I've tried this same protocol on other people that I work with. I have another beautiful client, Paula, who has an interview on my YouTube channel, Gwen Miller Studio on YouTube. And Paula shares her EDS journey, and she's still going through the EDS diagnosis. And it's just really, really interesting. But she came to me and was in a wheelchair. She texted me one day and said, I think I need to see you. And I was like, what's up? She goes, I can't walk. I'm like, tonight at 8. That was all I needed to hear. I was just like, are you kidding me? And so things are better now, for her. But it's like just such a this population in particular, the folks who are living in hypermobile bodies with or without a diagnosis, I'm really passionate about supporting along with everybody else, too, that has a spine or hip or joint condition that's causing them any kind of problem in living their lives, well. But that was how the book developed around a client and how that protocol now, that's my case study. They both are really. So long answer to a short question. Probably shouldn't have had all that coffee this morning, Sarah.
No, that's wonderful. So every word was worth it. We get so many clients, at least I have, and I know other Pilates instructors as well with EDS. Oftentimes they're recommended to come and work with us. And I remember the first time that I heard about EDS, I didn't know anything about it. When a client came to me. And so then that led me on my pathway again of diving down the rabbit hole and learning more about EDS. And I had a client, it was very interesting. I worked with her for many years, and she was so hyper flexible. I'm hyper flexible as well. And she is way beyond where I am. And I am quite hyper flexible. And so we worked so much on stability because I just knew that's what, she needed. However, yes, I allowed her to work in fuller ranges of motion than more people. Being a dancer, I knew that if you have a full range of motion, you need to be strong in that full range of motion.
Exactly. Exactly. That's the whole problem with that old paradigm that you still hear from some allied medical professionals, this whole idea of keep them in their mid-range. And it's like, no, actually, I mean, keeping someone in their mid-range may be useful to strengthen and teach control, but we have to strengthen in the full range. I mean, even Brett Miller, Brett Miller has his easing Pilates Intel. And I did a couple of articles for him, a part 1 and part 2, common myths around hypermobility. And that's on my website, gwenmillerstudio.com. And also Brett Miller's easing is free to subscribe. And I highly recommend if you don't already have the subscription for that. And I wrote, this 5 common myths, part 1 and part 2. And he wrote me back after I submitted, and he goes, thank you so much. He said, people were telling me from early on, and he's a dancer. He said, not to hyperextend my knees. And he said, my knees aren't hyperextended. They're just straight. And so he was, he was like really, I guess, for his decision to not follow somebody else's opinion about what his body should look like. There's a should there, right? It was right on, because if somebody is okay, so we know, like, for example, in the knee joint, and that's not your spine, but okay, we've got the condyles of the femur and the tibia, right? So if this is my femur and that's my tibia, and the condyles are the bumps on the end, and when somebody straightens their knee fully, there's a screw home mechanism that occurs in the knee. Okay, so depending on whether you're closed chain or open chain, it's either the tibia rotating outward or it's the femur rotating inward. It doesn't matter. It's the same movement. It's just whichever bone is not fixed position will perform that action of that screw home mechanism. Well, if you're hypermobile, which means that your joints can travel beyond established norms, air quotes, right? Then you keep getting told, well, don't straighten your legs all the way. You might be way less stable than if you straighten your knee all the way, because you are not screwing home your knee joint. You see? So it's like it's a whole it's a whole different way of thinking about, like, what is healthy movement and how is that defined And what do those shapes look like? Okay, what do they mean, right, in an individual human? Any kind of a muscle length testing chart or a spine or bone or joint range of motion chart, the norms are norms. They're averages. They're not the be all end all. Even in my book, when I was looking up some of the information, like for example, in chapter one, um, chapter one, there's let me see if I can find it real quick. Page 16. Okay, there's this chart, and this has to do with the pressure on the lumbar discs based on body position. Now, I looked up and there were like 6 different charts with each one had a different measurement for each body position. Why? Because they were studying human beings, and human beings were all different. You know, there's this thing called biodiversity. And so that's why there's no numbers on my chart, because nobody could agree on a number. It was a range. And so basically what people did agree on that were doing these studies was that, yeah, laying down is way less pressure on your discs and your lumbar vertebrae than sitting slumped over. So yeah, so anyway.
Yeah. So we have about 10 more minutes. There's one more question that I have for you. And so I'll ask you to maybe try to answer it quickly because I want other people to ask their questions
Oh
too. I have a
shoot,
feeling
sorry,
there's
Sarah.
no, no, no. Everything was exactly what we needed to hear. I also just believe in that in life. Like, yeah, things are meant to be, or we can at least find, find something in there. Right. So I loved how you shared Brett's newsletter, which I dropped in the chat. I also have written an article in there called Transformative Language. And that was one of the things that Gwen and I went down the rabbit hole in our conversation. You can see that those of you who know me, and I'm sure those of you who know Gwen, we can talk. And
We can talk.
we have so many ideas and we can talk forever. And it's so challenging sometimes. Um, to rein us in. And I think that some of you out there also would love for this to go on all day. And we should just be sitting together in the same room, having tea and lunch and, go hang out, take a walk, or something as we're chatting, do some forest bathing or something. Maybe that's a good idea for we could do Bay Area book club and meet in person. So my last question for you is, oh wait, that's not the one. What are some of the most common misconceptions about back pain and spinal conditions that you hope to dispel with this book?
So I think the common misconception, the reason that I wrote the book, the reason that I wrote it for lay people and for practitioners and teachers of Pilates, yoga, fitness, massage therapists, etc., is I really wanted to provide something that would be a tool for empowerment for movement. And I think that what needs to be dispelled is the fear around movement for people that have experienced pain or for people that work with people in pain. There's and of course, I mean, fear is a good, healthy thing. It keeps us alive, right? So, but there's a kind of a mindset that we can get into. Like if I have pain in my spine, my first thought is not get out and go move. My first thought is I'm going to freeze in place and I'm going to stay still and I'm not going to do anything because I'm afraid that I'm going to exacerbate the pain. And so that's like number one. I believe that education is empowerment. And I believe that when people receive education that lets them understand what is going on, whether that person is the person who's experiencing pain or the practitioner who's working with that person, that we can understand, okay, this is what's going on. So these movements are appropriate. And if someone doesn't have a diagnosis, it's really actually almost a little bit, easier. It's like, let's find positions of comfort to move from. Let's do that first. And let's start finding ways that we can move without feeling like we've got to literally bubble wrap and mummify our clients in some kind of a bracing pattern, which can actually create its own pain pattern. We're talking about stability, but then we talk about mobility, and we talk about this tendency to kind of like brace, and hold on for dear life. And that can itself be a pain generator. Okay. So to the education and the empowerment for both clients, individual, and instructor, teacher, I think it reduces the fear level and increases understanding, because when we're in partnership with a client, they feel our energy. So if we're at all uncertain or nervous or unsure or afraid that we're going to hurt someone, they're feeling that. So this is a tool. This is a tool to be able to say, hey, this is something I can look up, researched. Here we go. It's foundational. Read about the chapter that pertains to you, use it as a client education tool, because we need to get people moving. All the research that's come out about back issues and back pain and other types of pain, I mean, really most of it, all of it that I've read, I haven't read anything that says that not moving was the answer. Everything I've read says get them up and get them moving as soon as you can. And the real key is, let's make sure the movement is appropriate. So if someone has a spondylolisthesis, for example, which is anterolisthesis, forward slippage of one vertebra on top of another, we're not doing back extensions with that human, right? That would be contraindicated. So if we know that, we're like, okay, so now we know actually Pilates is perfect for that individual with all the flexion bias, right? But so we know that if we can follow certain guidelines, we can keep that person safe. And then again, we check in with them. How's this feeling? How is this working for you? Because then we get that feedback and that communication so that we can listen to what their experience is. Okay, so that's what I'm really trying to accomplish with the book and with my work in my coursework in the dynamic spine.
Wonderful. This is exactly what I was hoping to hear.
Oh, good.
Oh, you're getting hearts there. Yay.
Thanks, Danny. Aw.
So what questions are you all out there festering and dying to ask? Feel free to pop it in the chat or raise your hand or just unmute yourself if no one else is jumping in. Yeah, go ahead, Elisa.
So I could talk about this stuff forever. So thank you, Gwen, and thank you, Sarah. So I'm a student again of Pilates, and I happen to have injured my lower back when I was a lot younger. And it happens to be right now, right this minute, I'm in a bit of pain. And then also, I have a student that I'm practicing on, has pain and extension, and she's hypermobile. So she is a dancer, and so this kind of, all of this really hits home for me, because especially the piece that you said about being afraid to move them. And so I guess my question is, like, she doesn't have a diagnosis. I'm not sure what's going on, but she says extension, and is what, like, she found in arabesque. She had injured herself, and she really wants to, you know, have that line, right? And for performance sake, and she still wants to perform. So what I was thinking, and I guess I just want kind of a little bit of feedback as to, I don't want to shy away from extension. I want to build that strength, like you said, around give her a kind of a inside out thing, right? Like get her strong for using her her transverse and her pelvic floor, and getting her really to know what her limit is instead of the line. Is that a question?
It's a question, and I've got a question too. So, did she begin experiencing pain on extension after a certain event? Was there like a time where she felt something sharp? Like, was it on a landing or something like that? Okay. Has she had an X-ray? Okay. So, to rule out a spondylolysis, okay, I highly recommend. So the way I tell, and this is one another thing that I really feel like very passionate about, is let's partner with our medical professionals. Okay, let's get that information, because it's out of our scope of practice to diagnose. But I would want to, if I was working with this human being, to rule out a spondylolysis, which would be a fracture of the pars interarticularis. And that's a common injury in dancers, gymnasts, football players, younger people, sports specific, older people, because of wear and tear, you know, changes in the structure of the vertebrae, et cetera. And that X-ray has to be done at an oblique angle to capture the pars interarticularis. And it's best if it's done standing weight bearing. And the so to rule that out, and so then if that's ruled out, then you're probably looking at a more like a sprain or a facet joint issue. Okay, so the facet joints have little discs in between them, and so that, you know, if you're going into arabesque, you're like in hyperextension in the lumbar spine, you've got one leg lifted. So that's actually a little bit of rotation. And so actually a facet joint test, Kemp's test, involves back bending and running one hand down your thigh. And if that's positive, that is for a facet joint issue, which is in our scope of practice to do that assessment. And I teach that assessment in my course, but it's not our scope of practice to tell the person that's what they have. Okay. Yeah. And but I think starting with the X-ray, and really highly recommend it. And I talk to people about it as just like I just told you, just to rule out anything going on in your bones. I highly recommend you get this X-ray, because the words rule out relieves the person of fear, and people will not go get a diagnosis because they're afraid of the answer. And, you know, my own experience working with dancers is never tell a dancer to stop dancing, because they're not gonna, they'll just find somebody else, you know? So yeah, but then the protocol that I would work on in studio until her pain has alleviated is I would be doing isometrics in position of comfort. So maybe iso abs from the book, AOS POS from the book. So you've got her supine on the reformer or on the trap table. If bringing your legs up in a tabletop creates pain because of the pull of the psoas on the lumbar vertebrae, you see, then you want to have her feet down on the trap table with the knees bent, with maybe one of those little butt wedges underneath her to tilt her into a posterior. Yeah. And so I would find some positions of comfort and really work on the transversus work. Because if you consider if there's back pain, there's going to be inflammation, which decreases space in the back. And this probably also has tightened up in the back. We want to go to the opposite side of the trunk and work the abdominal area, the deep abdominals, as the opposite mover so that we take the nervous system's attention away from the squeaky wheel. Does that make sense?
Yes.
The
Yeah,
other issue, the other
absolutely.
technique I would encourage exploring, and this is also in the book, and I believe it's going to be in your chapter 4. So I would just treat her like that for now. I would treat her like a spondylolisthesis for now until you find out for sure, because that's the responsible, in my opinion, thing to do. Would be to look at an SI belt or even like a back brace. I actually have a recommended products list on my website that will just, I've tried a lot of these things, but just as an external stabilizer, because the other thing that happens when someone's having pain is they will, you know, that area, because there's inflammation, because the space is decreased, normal movement will then continue to irritate. And so if we can provide an external brace just to stop the irritation, the person can heal up much more quickly.
Okay.
Okay. So yeah.
That's such
Great.
a
Thank
great,
you.
it's a wonderful, comprehensive answer. Thank you so much
Thank
for
you.
sharing all of that.
It's my pleasure. That's what I'm here for. I mean,
Right.
honestly, I could keep going just with a bathroom break. I could keep going.
I know, and we all do want you to keep going. However, I also want to respect everyone's time. So, Gwen, I would love for you to drop any links in the chat for our audience right now, and then I'll provide them as well on our YouTube replay. So, links to your website if people would love to work with you, which I know they will. Your YouTube channel, that would be great also. And maybe if you don't now, I can also send out if you don't have the link now, I can send out a follow-up email to those that registered, as well as sticking it in the YouTube replay, a link to the Pilates Intel article if you have it available. So she was just, speaking about one of the conditions that's in here, safe movement for all spines. And that information regarding brainstorming and talking about protocols for specific injuries, she has, I'm sure, so much more in her brain to share with us that is even in this beautifully thick book with so much great information. So highly recommend you all pick up a copy of this. And one of the things that we spoke about was that this book is not written only for Pilates instructors. She wrote this in a way that is accessible to our clients, which is just so wonderful. So like she was sharing, this needs to be like a phone book in your studio. I know some people don't know what phone books are anymore. There used to be these big, fat, thick things that we would have people sit on instead of moon boxes.
And they had yellow pages and white pages. Yeah.
Yeah.
Yeah. Those
And
are the
so,
days.
so this should, I think this just needs to be a great adjunct for every studio to have. And then Gwen, because I know that again, there is so much more like in each chapter could be a book. Are you planning on continuing and maybe writing some additional books in the future? And then are you also able to, in our Facebook group, or right now we're on Facebook, and if there's other ways that you all would love to communicate, let me know. It could be also in the thread on YouTube, but are you willing to maybe answer some more questions if people didn't get their questions answered
Oh,
today?
I'd love to. Yeah, absolutely.
Monitor that.
Yeah. I mean, I just love to, collaborate with colleagues, and yeah, I forgot my Facebook page as well. But yeah, I love that. I do. And it also, it's like, if you've got this, right, or you come take my course, it's like I feel like part of my job really is to help you like utilize it in real life. This is the value of case studies, isn't it? So we learn how to apply what's in there in a real life situation. I mean, I don't know about you guys, but that's really how I learn best, is applying it. So yeah, I'd be happy to. I'm in the Facebook group, aren't I?
Mhm.
Yeah, okay. Yeah, or you can reach me through my website contact form or message me. If you would subscribe to my YouTube channel, it would make me really happy. It's free. And I have a bunch of spine safe mat classes in there that have a lot of cueing, inclusive cueing for people with spine and joint issues and little tips and things like that. So, but yeah, happy to collaborate. So, in fact, one of the things that I do on a fairly regular basis is I will have a colleague or student colleague bring a client to me for the assessment, and the client pays the assessment fee, which is it's not that much, you guys. I mean, it's but they pay the assessment fee, and then you get to like sit in on the session so that and then you take them home with you and you work with them. I don't have time to, like take on new ongoing clients as a regular basis. I want to empower other teachers to be able to have the confidence and to work as effectively as possible with their own clientele. So, yeah.
Yeah, such a gift for yourself and your clients to be open to that type of an experience. I love that you're doing that. That's something that I think more instructors out there, more educators, yeah.
Yeah, I
It's
love it. There's
hard.
plenty of people for everybody, and we make each other stronger by collaboration. So,
Exactly. Yeah.
yeah,
We're both of that mindset. We're here
I
to lift
know we
each
are.
other up and lift everybody else up along with us. So thank you so much for your time and generosity. Thank you everybody for coming today. I look forward to having you at the next book club. I have an author in mind, but you're always welcome to pop in other book ideas in our chats and in Facebook. And I will see if this next author is available for our next Meet the Author event. I wish you all a wonderful movement-filled week.
Thank you. Thanks for having me. Okay, it was nice to meet you all. Okay, bye.